we're talking about people who have awesome jobs with professional sports teams, but turns out they don't really like it when they're doing it. So maybe that shouldn't be your goal if you're listening to this and you want to go into professional sports.
I remember when I got right out of chiropractic college, I was starting to look for a job, and I went to school in Houston, and my grandma was like, you should get a job with the Astros. And I was like, yeah, that'd be great, Grandma. She's like, they're not that good, so maybe it'd be easy to get a job. This was like early 2000s. They weren't good. And I was still like, that's not how it works. Actually, I don't know how it works. I'm still in school. But I've noticed that I don't know that working with a professional team, especially right out of college. Actually, I take that back. If you could work with professionals right out of college, that's like jumping into the deep end. And so sometimes right out of school, people are like, pass the boards. I'm here. Let's do this. And I think it might be nice to get a little slap of reality right away and build a resume maybe. So I take that back. Work for a pro team if you want to. Right away. In the middle would not be good. Maybe towards the later end of your career might be good too, but definitely some valuable experience one way or the other.
I do have some experience with this, but I would say if you don't make it and that was your goal, don't beat yourself up too much because it's so much of who you know.
Absolutely.
Like, the athletic trainer for the team does not necessarily mean that they are the cream of the crop athletic trainer, that because they're in the professional team, they just probably friends with the right people. And yeah, I don't know. Some of them are great probably, and some of them are very mediocre.
You've got to love it. Is what I'm told. You've got to really, really like what you're doing and care about it. If you don't like basketball or you don't like the PGA or golf, and you don't want to follow the PGA Tour around, then, find something you love. If you're just like, basketball is cool, I could do that. No, you need to know the difference between a 1 and a 5 anyways in basketball. But let's get back to squats, right? So part 1, we went over some stuff. If you haven't listened to that, you should go back and listen to that episode. We will reference some things from that episode. Otherwise, we're still going to kind of take some of the concepts from that one and kind of evolve them, if you will, dive a little deeper. But yeah, what were some of those concepts you wanted to go over, Bobby?
Yeah, I think this might be an ongoing series, right? Part 2 and 3 and 4 and 5, and we'll see how far we can take it. And
squats forever.
Squats forever.
Or not.
Well, I wanted to talk about some things that are perceived as a technique or a form of squatting that sometimes can be misconstrued as a technique, or a form can be misconstrued as a cue and vice versa. So, like, for example, what do you think of when you hear the cue or technique of keeping like your weight on your heels when you squat? Because this is something I've heard often, or I've had patients tell me, well, that's kind of at odds with what I was told because they're telling me to put my weight on my heels. Yeah, just let's see where you take that.
So the name of the game is this a cue or is this form, basically, right? Obviously, it is a cue where people are asking them to be on their heels, so I can understand where they're trying to tell them to do that. In an attempt to fix their form, I guess. I've had a lot of people that when they try it, they seem to almost pick their toes up. And so, my grandpa told me many times that there's a ditch on both sides of the road, right? So I do think it's important to put your weight on your heels. But I also know, for instance, that your forefoot and your toes need to be on the ground. Where do you go with this one?
That was a good answer. I mean, John's is a football player, soccer player. So I wanted to hear what his thoughts were on that. But Yeah, often that should definitely be a cue, not necessarily a technique where you want to keep your weight on your heels. And in my opinion, because if somebody is squatting with most of their weight too far forward, they're kind of maybe they're overextended and you can see their heels are coming up and those knees are going forward too early. It's okay to cue that CrossFitter or that client or that patient, hey, can you shift your weight onto your heels so that you have the heels down? Because without the heels, you lose surface area, you lose area to push off of. And this is a very common, I think CrossFit is, every year I see CrossFit getting better and better coaches and better, they're smarter and smarter and better with what they do. But early on, I mean, I don't think CrossFit could have mount a very good defense of this, but just was, normal people trying to coach these things, and they can be very nuanced. So if you're like John said, if you shift your weight back onto your heels, but you were already flat-footed, I think you actually made your squat worse. And the real strength coaches out there, the strength athletes, like on the previous podcast, I mentioned learning from watching powerlifters, strong women, men and women uh, that you see pull or deadlift or squat keep their feet flat. Their toes do not come up, and they push through the entire surface of their foot. And any part of that foot that you lose power, in my opinion.
Yeah, no, that makes a lot of sense. In terms of the foot or the heel, I think you want that broad, as much of a base as you can. You were trying to move force through the earth back and forth, and if you are just through one specific part, like all through the heel or all through the foot or all through the arch, then you're losing it. I also see what you're saying in terms of, like you'd mentioned, I played soccer at university in college. So in America, we say soccer in college. Sometimes in other places, they say football at university. But for most sports in that sense, you want to be on your toes, right? You're playing defense, and you're just going to find yourself on your toes. If you find yourself on your heels playing football, American football, even, you're going to fall usually. Like, they got us on our heels. You're probably not on a way putting yourself in a good form in which you can react to the things in front of you, right? And so there is that differentiation. But with the squat being, I don't want to say not dynamic as out on a soccer pitch or, a rugby pitch, your feet are meant to be stable. So you want as much of a stable surface as you can. That would be the direction, I think. Now, there are people who are talking about the 2 feet being stable. And I know that there are some people like the Mike Boyles of the world who will train a lot of their hockey players. They do a lot of baseball players, professional athletes. And Mike Boyle is a legend. And he really emphasizes one-legged explosion, one-legged strength. I don't know to the full extent that he doesn't do like deadlifts. It's not all single leg deadlifts. Or have you come across this where people are like, don't ever train on 2 legs?
Yeah, but that's definitely the minority. I mean, I think
Yeah.
there's some people that swing all the way that direction to say that that's all that they want their athletes to do is unilateral exercises. And you kind of almost can empathize with their point, because I think if anything, we overutilize bilateral exercises, right? Just the standard squat. But how often do we do something, sport or otherwise, completely in a squat position? I mean, there's times that you will be in that position, but often you are doing reciprocal activity, side to side, rotating, lower body's going one way, upper body's going the other way. And I don't know how you can train that or learn to do that with a bilateral squat. With that said, there's also this other camp that's hard to refute, that is saying, hey, you don't, training is not the way that you win championships. The number one reason you should train is to prevent injury. I think that was the Indianapolis Colts strength coach that said that. It's the number one reason why you strength train. And sometimes it gets conflated as strength training and performance equals, results on the field, which we discussed in the previous episode about a football player who cut his squat in half and felt like a much better athlete. So you have that camp who is all about getting the numbers up, and then you have the other side who, maybe rightly so, has been pushing more for, hey, let them play their sport. This is how they develop the skill. And then there are times, yes, I mean, if you're an offensive lineman in the American Football League, like, and you don't have a bench press over 200 pounds, there's a minimum threshold that you have to just hit. And I think after that, it's superfluous. So, I mean, if you can bench 400 pounds as a lineman, I'm pretty sure you're probably fine. If your problem is you need more work on the field, you need your position coaches to work with you.
100%, man. The camps on both sides, I do think it is the trainers of the world, like we were talking about in the beginning. I think the best trainers in the world are first part of that team, whatever team they're on. Like we were talking about, like the most, I think the current Lakers trainer, on his Instagram, he'll put these kind of cool twisty exercises, and there's really no context. And so I think he does that intentionally, and he's totally right to, he doesn't have to explain himself, right? Maybe that exercise in that moment is perfect for that player, right? But he'll put these kind of cool exercises, and people are like, whoa, look at what he's doing. I think the best trainers, however, subordinate themselves to the needs of the team overall, right? If you're on the Lakers, you're here to win games. Well, you should just do what LeBron wants you to do, but I think the best trainers are not like, every point guard must have an agility test of X, Y, and Z. But I do think you're totally right. I think those best things really should serve those higher kind of purposes, though.
So on the last podcast, we touched a little bit on variability and like the ability for your body to find variability, and that being important. And I'd want to hear what you think on the difference, or the difference between two-legged and one-legged, or how maybe unilateral work could help with that concept that we touched a little bit of, increasing your body's ability to accept variables.
Yeah, let's start at kind of the beginning when we talk about variability in terms of like a screen or something like that, or something that we've identified outside the training room, basically, where, say, for instance, I've got a lot of right ankle sprains. My right ankle now has a more narrow variability where after I've sprained it once or twice, it is more likely to sprain. So if in the gym I'm doing some kind of one-legged right foot kind of balancing stuff, I'm trying to increase the variability that my ankle can handle in the gym, but for purposes out on the pitch, right? So hopefully if there are those specific needs that we know that we need, that you can kind of tease those out and work on those in the gym. So like as a thrower, and I don't know much about throwing, but I know John kind of started doing these one-arm bench presses, right? Probably one of the first people to get a dumbbell and just push off of one side, because he noticed he was throwing and his right arm was just like hulking up and his left one wasn't quite so much. So in that sense, he was trying to level out his variability, where he knows he's spinning around to the right over and over. So if you know that you're spinning to the right, throwing a javelin or a discus or a big stone or whatever, right? You probably want to add some variability by dumbbell pressing on the left to kind of counter those things. That's the kind of initial way that I think about variability, from a baseline kind of level to kind of adapt to what the needs are outside of the gym. Where do you go with it?
That's good,
Yeah.
but I have a follow-up on that was really good, but I'm also thinking of variability in the sense of, like, your joints have variability in them. So often, like, I've had a patient who wants to improve their overhead squat, and then they want me to look at their overhead squat and fix it. And my response is, you can't fix an overhead squat with an overhead squat.
Mm.
So
Yeah.
thinking more along the lines of, we talked a lot about the squat in the first episode, but there's so many other squats like single leg squats and uh, pistol squats and lunges and Zercher squats. But if we think more, do you think there's a benefit to doing some more unilateral work that could help find more joint variability, in the sense that if you, let's say you do Olympic weightlifting and you're doing a snatch, and you have your mobility only works in a certain range. You have to have the exact grip on the bar. You have to catch the bar at exactly 53.9 degrees, and that's where your knees and your hips and your back will have the strength, and your shoulders will be able to catch the bar. But if you accidentally put a little bit too much on and you squat a little too low, you can't catch the snatch, because you have no ability to accept this perturbation, this change in the system. So, and this, I think the world's best athletes can do this. This is why you can't train something like Barry Sanders, a running back, from the 90s. You just can't do that. But these weightlifters, it looks like they should never have caught that snatch. They will shoot their knees, almost anatomically impossible, far forward to somehow catch it, and they'll jiggle one elbow back just to, correct it, and they stabilize it, and they still manage to stand up. And you can't do that if you have a very narrow, um, a narrow arc of possible movement options, right?
No, so yeah, I that makes sense, a lot of sense. It's kind of like that. I don't know if it's Bruce Lee or the practice guys. Like, it's not practice that makes perfect. It's perfect practice that makes perfect. So I understand there, and this notion of you need to squat exactly like you're going to squat on game day. Yeah, you should practice perfect form, but you need to have some outlets in case things go wrong. Just on the given day, on a given week, you might not feel the same as you did in training. So in training, in terms of training variability, where people are, let's just say, doing a high bar back squat, that's kind of our goal. We want to PR there. There's a CrossFit competition or whatever. And you've got that movement down, let's just say that, on 2 feet. If you wanted to build in some variability, you could, in fact, start working on your front squat, right? So you're carrying that same kind of load through that same, not the same kind of load. You're going through that same movement with a subtly different load versus the back of your shoulders to the front, right? So you are adding in some variability such that with that weight in front of you, like a classic front squat, you in turn have to shift backwards, right? So you are building that variability there. So there are some people who will do stuff like that, or the Zercher, right? Where they're kind of almost like, if you think about curling it, right? And they're just kind of sitting on their elbows. And so the weight is a little bit lower. And so you're adding a lot more weight there. If you can control that same kind of weight through that squat motion, right? That triple flexion, and then change the variability and load, whether it's on your back, whether it's on your front, whether you're holding it kind of in the Zercher. The other parts of variability, besides varying where you are putting the load through that same movement, would then go towards things like speed, right? Are you doing it really slow? Could you lower the weights and do it fast, right? And such that you're not going to do the same speed. The bar path and the bar speed every time is not going to be the exact same click rate. So if you work on doing it very slow going down, very slow going, you need to kind of build in the variability of lowering the weight and working on exploding up out of the hole, stuff like that, right? Or I'll tell you, this is one thing that kind of blew my mind when I first heard it. It was Pavel Tsatsouline, right? The guy who's kind of responsible for bringing kettlebells to the West. He had an episode on Rogan lately, very worth listening to. And if you see any Pavel books, Power to the People, or his, I thought his one-arm push-up and one-legged squat book would be kind of dumb. I was like, what? How much is there to a one-arm push-up? I was wrong. He talks about in a squat, pulling yourself down to the ground. And when I heard this, I was like, Whoa, what? So, and there is this idea, and it sounds really foreign, but some people just kind of, I won't say mindlessly, but just drop into the squat versus actively building in that variability of pulling yourself down. So just kind of focusing on, changing up these variables, working on pulling yourself down, changing the load. Those are the first kind of variables I kind of think of.
I, I, I I think it was Pavel. Otherwise, it's just a Russian saying. It's one of my favorites, which is, if you want to press more, you have to press more.
I love it. I love his program minimum. And then he has program minimum. I was just like, dude, I'm so sold. Russians are so Russian, and I love it, man. I wish
Yeah.
I could be like, here's program minimum. And the update to that, program minimum. And I was like,
Yeah.
here's my money. Take it.
Well, bring me back to the Russian philosophy after this. Okay,
Absolutely.
try to do that.
Absolutely.
But keeping on variability just a little bit longer. One thing I was thinking of, with maybe a detriment to focusing only on two-legged back squat. Um, and this gets a little nerdy, but we've been mainly for the trainers here. So for the clinicians out there, the neck of the femur on most people angles forward about 15 degrees, 14 degrees, something like that. So femur comes up, but the neck going into the head of the femur is angled forward 14 degrees on average. The acetabulum, the hip socket, also is angled forward at about 30 degrees. So this is why the closed pack position, if you get into some of the books, talk about you need hip flexion, a little bit of internal rotation before you get in this closed pack position, or centrated position, where the head of the femur is perfectly centered in the acetabulum, in the hip socket, where the greatest coverage is. Honestly, it's an area where you probably have the most equivocal power in all ranges to go either internal or external, or to explode up or down. Right? It's a good position to be in, but in upright walking, maybe in quadruped, we actually are mainly in the centrated hip position. But the byproduct of learning to stand up and walk on two legs is that we don't typically have a centered hip when we walk. And if you think about it, we have necks of femurs going forward on acetabulums that are also going forward. So in order to centrate a hip, you need to squat a little bit, and your femurs have got to be able to rotate inward. And I think for somebody who focuses, especially more, if you just really picture like a low bar powerlifting squat, this style of squat, they're almost externally rotated anyway, probably hyperextended a little bit. And they're really grooving this pattern. That's fine. And if you're a power lifter, I mean, do that. Do whatever it takes to lift the most weight. I'm not talking about a power lifter. I'm talking about somebody who wants to play with their kids and go golfing, and then occasionally play pickup soccer, basketball, whatever. That I think you're not able to access the 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 other ranges of your hip by doing just a two-legged squat, because you should have some internal rotation. You should be able to go into a full squat and be able to tilt the hip backwards, like we talked about in episode 1 a little bit. But think about how difficult that is if you already lack that, based on upright walking and this angulation that we already have at the hip. So why not? Let's train some ranges that we can only really find by doing unilateral work. Some stuff that John described of a female in the last episode, doing these like push off of a box with one leg jump, like these kind of explosive jumps. Doing lunges where you're rotating, where your upper body is rotating left while you lunge forward with your left leg. Your upper body goes left, but your left leg goes forward, so your hips are going to the right. Something where you can access this rotation. And I know you're a kind of a magical, voodoo-y exercise guy that comes up with awesome stuff. What do you do? I mean, you know what I'm talking about here. I need somebody that needs to access both hips, not just one, get in so they can shift left and right to be normal when they walk or when they perform. I don't believe they can do it with a two-legged squat. So, I mean, where would you go? And I know maybe 10 years ago, I feel like I asked you a question about internal rotation and you had some good answers back then. So,
Geez, I hope I can be like I was 10 years ago. But, well, yeah, so, yeah, external rotation does kind of drive that power, the knees out idea, like Bobby was saying. It is required if you're going to move heavy things. Um, Pause, period, tab, next paragraph. After you're done lifting, I feel like a lot of those lifters who are heavy into that rotation take that into the day-to-day, right? They go lift heavy stuff and then they go back into their car. And the position that you're kind of talking about with the external rotation, the natural way that the femur sits in the acetabulum. If you think about, if you were to just kind of relax, your legs usually kind of fold outwards, right? We're prone to crossing our legs or kind of sitting with our ankles crossed, basically crossing one knee over the ankle. It's just more comfortable to kind of let those sit out. And what that does is just kind of, you're sitting, I don't want to say bone on bone, but you're kind of resting at your joint's end range in external rotation. It's very rare to see people who want to sit with their legs inwards. Maybe you can think of maybe probably like some high school girls basically who will sit kind of that way with their feet pointed outwards, almost like a W, but it's pretty rare. That said, capturing that internal rotation, centering like you were talking, allows for a more powerful external rotation and explosion, right? So if you can kind of think about centering a joint, you can kind of prepare it and wind it up, and then you can kind of explode out of it. So this is where I think internal rotation, at first you're like, you got to keep your knees out. But I'm saying, look, man, if you want to wind that joint up, if you ever look at those anatomy pictures, and on one side you'll see the femur going into the socket, and usually on the other side there's this a bunch of ligaments. You can kind of see them twisting and kind of torquing, right? When you go into that external rotation, those things are kind of unwinding a bit if they're out of that centered position. Now, if you roll that more towards that centered position or the internal rotation, then you get to kind of bounce back out of that into external rotation, kind of creating power. So this is kind of the value, I would say, for those people who want to move heavy things, who want to squat heavy, to work on internal rotation. So it's kind of like these single leg things that we've talked about. We talked a little bit about it in the first podcast, like pistol squats, right? And if you want to think about centered as you're moving, you can almost think about it in an Eastern sense, where the tibia would be your peg, as they might say, in some of the Tai Chi things. It is kind of your stable point. If your foot and tibia are straight up, then that femur needs to be over it if you're doing a one-legged thing. If you're doing two legs, I understand that tibia can be torqued out, and that's fine. If you're on one leg, if you're on one part of the gait cycle, you're balancing weight over one foot, you want that tibia straight up. If then that tibia is straight up, you don't want to crank your knee out into external rotation, you're cranking it inwards. After that, you can kind of see, hopefully, that if your tibia is straight and your femur and your knee is almost pointing inwards, your hip then is outside of that, right? So your hip is almost externally rotated while your femur is internally rotated. This is kind of the position we're talking about being good at, like a pistol squat, basically. Or we talked about the box. You mentioned something in the first podcast about putting your foot up on a high box and pushing down really hard. That is essentially kind of a secret to kind of to inhibit external rotation, but really juice up internal rotation, right? Which is centering it, or centrating the joint. The trick is then, once you've got that joint centrated, like I said, to then be able to explode up out of that position. So not only, at least clinically, sometimes if you can capture and centrate a joint, and this is some of the kind of the Prague school people would talk about, if you could centrate that, if we know that you're overly externally rotated, we internally rotate, we centrate that joint, and sometimes they just do it in one position, where basically they've got that femur kind of almost sucked up into the acetabulum. A lot of the trigger points should kind of melt away. Really just means they're balancing out external and internal rotators, some of the chain of muscles that's connected with that. But the trick is, because you can do some magic with that, and if the patient's really hurting, you can get them out of some pain pretty quickly. But sometimes I'll have a patient leave my office and they go walk down the hall. By the time they turn around to come back to my office, their body's gone back. The pattern is wound back up. And so this is kind of what we're talking about having to groove. Bobby said kind of groove that pattern over and over, right? So the main trick, I would say, at least clinically, and then we can kind of, maybe you can take this into the gym, at least clinically centering that joint, right? Capturing that internal rotation from where they are, and then having them kind of move through some basic ranges of motion and just controlling that in that centered position back and forth. Maybe not even adding weight yet, at least in the office, but just kind of grooving that motion where they are balanced between internal and external rotation. If you can do that a couple times, that's some magic. That kind of, how does that, what do you do for that in the gym though?
And for you guys, I mean, John has posted recently. I think it's on our Instagram, but he can post it again and do some more videos. But
Oh,
he did a good video of showing this idea of a femur moving on an acetabulum or an acetabulum moving on a femur, and it could be a really nice screen for you or for your patients to kind of get this idea of centration. And if they don't like one of those, or especially if they don't like either one of those, they're definitely, that can kind of answer your question right there. They're not centered in the hip. Um, this ability to when you have a centered hip, what in the gym, and John also mentioned grooving the pattern, right? If you have somebody, maybe they have shoes on, they don't obviously have their toes coming up, but you can ask them what they feel. So if you do a squat and you say, where do you feel your weight? And if they say, well, mainly on the outside of my foot, and then, you know, maybe a little bit at my heel, say, do you feel your big toe at all when you squat? If they say no, it doesn't mean they maybe don't have access to it, but maybe they don't know how to use it. But for the sake of this conversation, if somebody who is more in that externally rotated, doesn't have access to a little bit of that internal rotation and flexion that you really need more as you get deeper into a squat, they won't be able to utilize the inside of their feet, the medial portion of their feet and big toe very well. You should be able to keep pressure into the floor with your feet, medial arch and toe throughout the entire squat. And some people will describe it as they don't really feel the floor very well. And I've had moments like that too, where I can't feel like, where do I put my feet to get the most power? Every time I do a squat, I want to put my foot somewhere else because I can't feel it. That's the problem. You should be able to, I mean, feel like you have power that whole range, all the way going down and all the way coming up. And if you have that feeling and you can really drive through your feet and keep your big toe on the whole time, it's a really good sign that you or your client or patient is also doing a good job, or possibly has a hip that's doing what it's supposed to do.
no, that makes a lot of
So,
sense. And you said something that actually cleared up what I think I was trying to say. Mechanically speaking, when you are dropping down into the squat, when you're going down into the hole, as they say, right? If your femur is staying still and your pelvis is staying still, they're not rocking back and forth. You have to imagine as that pelvis is descending and that femur is staying still. It looks like it's staying still. It is actually internally rotating passively, right? As it is descending. And so if you find that you are having problems getting lower into your squat, now, yes, it looks like your knees are out, but in relation to that pelvis, you must internally rotate your femur to some degree to get down into the squat. So if you're having problems just getting down to the squat or lower or breaking 90, right? Or you were talking in the first podcast about people in Asia squatting down. They have internal rotation, right? They can get down there, hang out down there. They're healthy down there. And this is another thing. A healthy joint is healthy at end ranges, right? Very rarely here in the West do we spend time. We spend time at the end range. I would maybe not even fully extended, but definitely not fully flexed. We just don't, we're just not there often. So when we get there, or if we can't actually get to full flexion actively, it's not comfortable. And so grooving some internal rotation will help you get down to that bottom of the squat to explode out.
yeah, I mean, the last time I did a seminar on a squat a couple years ago, the statistic said something like 50 or 60% of the world still poops without a toilet. And I'm thinking the Western world, visit Kyrgyzstan like I did last year. I'm not so sure they're gonna be able to go to the bathroom, or they're gonna have to hang on to a tree or something. You know what I mean? They're not going to accomplish the task, and it's something very human that we are losing in the inability to internally rotate and flex and go down. That extension is okay, but yeah.
Absolutely. There was something else. So I will say one of the tricks, it's not a trick, one of the ways that you can get there a little bit more easily is that single-legged stuff. So with the pistol squat or the box step, one-legged box step ups, right? And slowly descending. So say you got one foot on the box, you step up and you slowly let yourself kind of go down, right? And this is CrossFit WODs over the last couple of years. People know that they destroy their Achilles when they jump up on the box and they jump back down, right? So CrossFitters over the years after the open comes, they're like, all right, we're going to jump up on the box, but make sure you step down easy because it will kind of destroy your calf and feet afterwards, because we're just not good on that descent. And if we were to open up our variability on the descent, that ascent just becomes that much more powerful, basically.
Yeah, I like
So
that.
the single-legged stuff is kind of the trick into it. And like I said in the beginning, there's a ditch on both sides of the road. So don't just do single-legged stuff. Kind of like we were talking about the trainers in the beginning, they subordinate their cool exercises they have to help people get back onto the court, right? They don't need particular minimums. We're using these single-legged exercises like a pistol squat or an assisted pistol squat, right? Like a goblet squat or the TRX that we were kind of talking about earlier, so that they can go back to their big lift and have a little bit more wiggle room when they're trying to. And that's something I would ask you to test, honestly. If you're listening to this, go squat, warm up, load up 225 on the thing, right? And do a squat, do a set or whatever. Then go do 10, 15 single-legged pistols, basically. Use a TRX, step up on a box, and just do your right leg or just do your left. Do one leg just as a test to see what it does to you, right? Go back, put some weight under the bar, and then squat and tell me that your right leg doesn't feel different after doing some single-legged stuff back in it. Now, ultimately, please do both legs, so you're not spinning yourself up naturally. However, if you notice that butt wink or that people are like, you're shifting more to one side, you'll probably notice on a pistol squat or a box step up, TRX assisted pistol, that your left leg or right leg might be a little bit asymmetrical. You're not quite as comfortable. Like I'm not quite as comfortable on my right pistol because of my right ankle having been sprained and broken so many times from playing soccer. But doing that certainly gives me a little bit more variability when I go back to trying to move heavy weight.
Yeah, I don't think they'll have a problem going back and doing the other side, because they're going to want to do that on the other side because the squat's going to feel so good on the first side.
Absolutely.
And yeah, I mean, there's a reason for a squat, a regular two-legged squat, right? Because that's where you can work on strength and power. You can't do in 200-300 kilos, 400 or 500 pounds with one leg, and you need to be able to do that because you do sumo wrestling or you're a heavyweight judo or whatever the heck, offensive lineman, whatever it is, and you need to be super powerful. But they each have their utilization, and you can use the single leg stuff to learn how to access some of these things. You can use the double leg to then groove the pattern, right? You say, I can't feel my big toe. I can't feel like, I don't feel centered in my hip. They're pinchy. I can't generate power in the bottom, whatever it is. You get those accessory motions. You get access to that again. You say, yep. When I do a retro stare, for example, I can feel my heel. I can feel my toe. I feel my hip capsule stretching. I am in internal rotation, and I got it. You can do it on both sides. You might do that for a while. You might do some more of the stuff John just mentioned, or box step ups, or anything where you can really feel this, and then get that barbell back on you and see if you can't replicate it 2 feet on the ground. And then if you can, groove that pattern and don't lose it. And then it's a simple test of, Are you losing it when are you doing too much bilateral stuff? You might start to feel like the power is losing, and you're losing your big toe, or you just don't feel right. You don't know where to put your feet again. You're kind of losing that centration of the hip.
Yeah, just one thing to add to what you were talking about with that step up test and kind of feeling the back of your, so and when you're internally rotating, this kind of actually, we explained this pretty well in our first episode on adductors, how the internal rotators or adductors are very related or synergist with the, say, glute med, right? The lateral hip, the posterior hip. So what Bobby's talking about there with the kind of step back, right, is you're going to have to centrate internally or medially towards your midline with your femur. However, that also gets you that external kind of rotation back of your pelvis. So if you're getting internal rotation and adduction of your femur, the opposite thing should be happening in your pelvis, in your hip, on that side ilium. So if you're having a hard time accessing your glute on the left, let's say, your pelvis on the left is not, you're not able to feel your glutes, say, like you are on the right, you may need to work on internal rotation or adduction of that femur to get external rotation of the hip, if that starts to make sense. Those two should naturally coincide.
Yeah, absolutely. Killed it.
Hack the hip.
It's a good one. And I think before we close, I just wanted to, a little bit. I did remember to go back to the Russians, because
Oh yeah.
I have and a lot of my training has been Olympic weightlifting, and there's different schools of thought. And I'm going to relate this just to anything. It's not about Olympic weightlifting, but I've trained in various styles or programs, everything from Bulgarian method to a little bit more of the Chinese method to the American method to Greg Everett's stuff to all this different stuff. And then there's the Russian method, right? Well, I think too many people train in life more like the Bulgarians train for the Olympics. So the Bulgarians, it's pretty much do or die with them. It's 6 days a week, 2 a days. I mean, and then if you break, it's self limiting. Like if you break, you're out of the Olympic team, and it's just whoever survives. And yeah, they're awesome. I mean, one of my favorite lifters is from there, and I mean they are from that method anyway, and they produce results. But I'm not so sure that they're not so broken after their career is done. So what they do is they go close to their maxes all the time, always going heavy, always going heavy. Now, of course, most of these people started out as kids doing this, and that's how they survived it. That's how they can tolerate those loads. But you can't start when you're 23 and your soccer career is done and you want to pick up CrossFit and you want to do a Bulgarian program. It's probably not a good method. And I wish in life in general, we thought a little bit more like the Russians do. And I mean, the Russians were way ahead of the game anyway, in sports science and Verkhoshansky and all these guys. I mean, and I'm not a professional on that kind of stuff, but with Olympic lifting, their idea was we want tons and tons and tons of volume in a medium range of weight. 60 to 85% is like 95% of what they do. And if you break it down even smaller, that 60 to 75% range would be their highest. And it's just so much volume in that area. So and I wish we would carry this over more into real life. So whatever it is that you're doing, going for walks, or, you don't have to be the speed walker out there that just goes once a week as hard as you can. It's probably not going to yield very much results. So think about this adaptation over time, this medium load and grooving patterns. And I know this from experience because I have way too many mistakes and too many current injuries from the egotistical mind in the gym. And to be honest, I was trying to impress myself, to be honest, more than anything, but I wanted to be strong. I always wanted to stand out, and it didn't yield, the best results to date. And if I had a Russian mentality, at least that Olympic lifting mentality, I think I would be at my strongest point now and healthier, as opposed to my peak is long gone and I have some broken things that I have to currently fix. I just wanted to close on this idea. So
I think that
comment.
that idea makes a lot of sense, and it works in a lot of different places. You know what I mean? pitchers in baseball, Larry Bird showing up early and just shooting 100 free throws before the get, this idea of repetition and not a strained repetition, but, over and over such that it is, I mean, I guess the coining today, grooving that deeply kind of into your nervous system is a really good tip that I wish more people would use. Well said.
That's a good aside, because I mean, I'm keeping my mind on the lifter, but I'm sure if we thought about it, we could make the connections everywhere. Like Larry Bird can't do full scrimmage, full strength scrimmage hours on end, but he can shoot free throws for hours on end. You can work on your putting game for probably hours on end, but not 400-yard drives. So there are ways where you can build yourself in ranges and with efforts that don't break you down, but they build you up over time. And then when you need to go when you need to go maximum, your body can do that. It's no problem. It's I forget his name right now, and every power lifter will hate me, but he's a shorter guy, but he never, his thing was, I never failed a lift in my life. Like, he never failed a lift in training. Only if he was going to fail, it would have been at a competition. And I like that mentality. And he was one of the greatest power lifters. Some do claim that he is the greatest power lifter of all time. So.
Well, and there's just that almost psychological safety. If I'm going out to shoot free throws and I know that I'm going to be out here for an hour and a half, and I make the first 5 and I miss the 6th through 10th, I'm out here for another hour. There isn't that I must do this absolutely perfectly all the time. Although you are kind of striving to be better and better just so that it is natural, there is that psychological kind of buffer where you're like, look, we're just putting in the time, we're putting in the reps. And I promise you, even though, every rep will not be perfect, that will become second nature. That will become like snapping to you. But I do like that even psychologically, it does give you a buffer there. That's smart. I like it.
Yeah. And to our chiros and physios out there, think about your patients. And if those 3 sets of 10 clamshells are not fixing their glute med pain when they're training for their marathon, think how can you get more good load in there? They just need maybe more volume to build resilient tissues. This 3 times 5 or 3 times 8 or 1 set of 30 just may not be enough, or especially one, 2 sets of 3 heavy back squats. You might need to regress them, but then you might need to add more volume. And I do think clinicians would err on the side of too little and just thinking that the body just adapts to some mild stress. And at the last episode, we talked about the 16-year-old going to GNC, taking every supplement he can, and he doesn't look any bigger months later, right? It takes time. So why do you think our, 1 set of 30-second plank is going to give you a strong core? Yeah.
Absolutely. That's a big one. I wish a lot more clinicians would listen to, especially like some of the tendinitises, man. Tendons. Yeah, well, we'll get into it on another episode for sure. But like an Achilles tendon, an elbow or something like that. Man, you can get some people relief with their elbow, with their Achilles, with their patella. But if you're not grooving and you're not getting some good load into that in a controlled and safe way, I don't know how you're going to be really successful with those little tendon things. But we'll get to that another time. Tune back in to the Anatomy of Therapy podcast. See y'all.
Peace.